Vitamin D is classified as a vitamin, but it's actually a steroid hormone. Your body manufactures it from sunlight, and virtually every tissue in your body has a receptor for it, including the cells in your testes that produce testosterone. By January, over 40% of UK men are clinically deficient, and most GPs don't screen for it. Here's how this works. The active form of vitamin D, 1,25 dihydroxyvitamin D3, acts as a steroid hormone. It binds to vitamin D receptors on Leydig cells. Those are the cells in your testes where testosterone is actually synthesized. When vitamin D is low, testosterone production is impaired at the cellular level, and the relationship is likely bidirectional. Low vitamin D suppresses testosterone, and low testosterone may impair vitamin D metabolism. Either way, maintaining adequate levels is essential. Studies consistently show men with vitamin D below 20 nanograms per milliliter have testosterone levels 10 to 30% lower than men above 30 nanograms per milliliter. Let's look at the data. Ware and colleagues, 2010, a large observational study of 2,299 men. Men with vitamin D below 20 nanograms per milliliter had an average testosterone of 400 nanograms per deciliter. Men above 30 nanograms per milliliter averaged over 500. That's a meaningful difference, and the association held after adjusting for BMI, age, and season. This isn't an isolated finding. Multiple studies replicate this pattern. Low vitamin D correlates with low testosterone. And in the UK, latitude 50 to 55 degrees north, where the sun provides insufficient UVB for synthesis from October to March, this is a population-level problem. Here's the UK-specific issue. From October to March, the sun is too low in the sky to produce UVB radiation at our latitude. Your skin literally cannot manufacture vitamin D, regardless of how much time you spend outside. Even in summer, most men spend 8 or more hours indoors working. So synthesis is limited year-round. The result? By winter, over 50% of UK men have a 25OH vitamin D level below 20 nanograms per milliliter. That's the clinical deficiency threshold. Many are below 15. Most UK doctors don't routinely screen for vitamin D. Most men don't supplement, and those who do often use the wrong form or the wrong dose. This is where most men go wrong. Let's fix it. First, form. You want vitamin D3, cholecalciferol, not D2. D3 is the form your body makes from sunlight, and it's significantly more bioavailable. Second, cofactors. You need vitamin K2, specifically the MK7 form. Vitamin D increases calcium absorption. K2 directs that calcium into bones and teeth and away from your arteries. Without K2, high-dose D3 can paradoxically increase cardiovascular risk. Always take them together. Third, dosing. The old NHS guidance of 400 to 800 IU daily is insufficient for correcting deficiency. That dose maintains sufficiency if you already have adequate levels. It doesn't repair a deficit. For UK men, the protocol is this. October to March, 2,000 to 4,000 IU daily, D3 plus K2. April to September, 1,000 to 2,000 IU, unless you're spending 30 minutes or more outdoors daily in direct sun. Test your 25OH vitamin D in March. That's your lowest point. Target 30 to 50 nanograms per milliliter, which is 75 to 125 nanomoles per liter. Supplement guidance is a population-level average. Your individual vitamin D status depends on several factors. Your skin tone, darker skin, means slower synthesis. Your occupation, office work versus outdoors. Your sun exposure habits. Your gut health. Vitamin D is fat-soluble, so absorption issues mean deficiency. And your baseline genetics. You could be at 15 or 50 nanograms per milliliter on the exact same protocol. Testing tells you. The protocol is simple. Test in March. Start supplementation if you're below 30. Retest after 8 to 12 weeks. Adjust your dose. Up if still below 30. Down if above 50. Then maintain and retest annually. A home finger prick test costs around £19 and gives you results in 3 to 5 days. There's no reason not to know your number. While we're here, vitamin D does more than support testosterone. Low vitamin D is associated with poor immune function, increased cancer risk, especially colorectal, bone loss and fracture risk, mood disorders including seasonal affective disorder, and cardiovascular disease. For men over 40 concerned with longevity, adequate vitamin D is non-negotiable, and it's one of the cheapest, highest return health interventions you can make. Full article with the complete supplementation protocol, product recommendations, and testing links is on maleoptimal.co.uk. Link in the description. If you found this useful, subscribe. We cover evidence-based men's health every week. No hype, just what the research actually says.